Prior to donning PPE, make sure that you are hydrated and do not have to use the restroom. Remove anything that might puncture your PPE, including jewelry, pens, or badges. Gather PPE for COVID-19 and respiratory enhanced precautions, including an N95 mask, isolation gown, gloves, and face shield or goggles. Inspect all exposed skin for wounds, cuts, and scrapes. Donning of PPE is always done outside the patient room. The first step is to sanitize your hands. The CDC recommends an alcohol-based hand sanitizer of 60 to 95% alcohol, or soap and water washed for 20 seconds. Next, put on your isolation gown. After putting on the isolation gown, you should put on your N95 mask and check it for proper fit. Your next step is to put on your face shield. Your next step is to put on your gloves, ensuring that the gown cuffs are covered. Your last step before entering the patient room is to perform a final PPE inspection. If your gloves become grossly contaminated while in the patient room, make sure you use appropriate disinfecting wipes and allow your gloves to dry for 2 minutes. Do not turn your back to the patient in order to keep the back of your gown clean. Avoid readjusting your PPE, especially your face shield or goggles, while you're in the room with the patient. Limit touching surfaces in the patient care area in order to reduce the risk of contamination. The doffing process begins at a safe location inside the patient room, at least 6 feet from the patient, and preferably near the door to the room. If you notice any gross contamination, make sure you clean it with the disinfecting wipes and allow it to dry for 2 minutes. Perform hand hygiene with an alcohol-based hand sanitizer. You remove the gown and the gloves together. Begin by pulling at the gown midsection to break the waist ties. Then, using both hands, grab the gown in the front of your chest, crossing your arms, and slowly extend your arms fully in front of you, pulling the gown off and forward. The goal is to roll the gown up slowly, turning the contaminated outer surface internally. You should lean forward slightly and hold it fully away from your body. Drop the gown and the gloves in an approved receptacle. Perform hand hygiene with an alcohol-based hand sanitizer. Don a new pair of clean gloves. Disinfect the front of your face shield or goggles with disinfecting wipes. This step is performed while you are still wearing these items. Be very careful not to touch the inside of the face shield or the goggles. Doff your gloves and place them in an approved receptacle. Perform hand hygiene with an alcohol-based hand sanitizer. Now it's time to step outside the patient room and close the door. Perform hand hygiene with an alcohol-based hand sanitizer. Remove your face shield or goggles. If you're wearing a face shield, grab the strap, pull it over your head towards the front. Place the face shield or goggles on a table for reuse. Perform hand hygiene with an alcohol-based hand sanitizer. Remove your surgical, procedural, or N95 mask, making sure to only touch the straps of the mask, and leaning forward, drop it in an approved receptacle. Perform hand hygiene with an alcohol-based hand sanitizer.